Hello and welcome. I'm Barkha Dutt. This is the Mojo Story. Our big question for our audience today: how do you make sense of the fact that we are a country where bars are open, restaurants are open, malls are open, movie theaters are open, but guess what's closed? Schools. How can this carry on? The United Nations is actually calling for the reopening of schools, and this is what the debate looks like in India. Let's bring up our big story on the program today. Vaccines for children should be here by August or September, says India's health minister. That's the good news, but that's really when it will kind of roll out. It doesn't actually give you any clarity as to when schools can open. The Indian Council for Medical Research is actually now saying that children are less vulnerable. There is no cause for anxiety, but parents are having none of it. Are parents the stumbling block to the reopening of schools? What should happen? Well, some states are going ahead, Haryana, Gujarat, Madhya Pradesh, and Bihar among them. But are children showing up to school at all, even where schools have been allowed to open? And are we underestimating the impact of this on our children? Because if we wait for vaccination, the pace at which our adult vaccination is going, this could take forever. Remember, you're already looking at 2 full years of school lost, a throwaway for children. By the end of this year, 2 years would be lost. So is it time to turn the lens back on learning to live with safety precautions with the virus when it comes to our children? As I said, the United Nations, the World Health Organization, is calling for the reopening of schools that have been shut down because of the pandemic. Let's introduce our experts on the program today. We are joined by Seema Agarwal. Seema Agarwal is the head of a parents organization, a parents nodal organization based out of Hyderabad. Welcome, Seema. Dr. Swapnil Parekh, otherwise extremely a cautious voice when it comes to reopening cities, but has been writing a lot about the paradox of malls and movie theaters opening ahead of schools. From a perspective from the schools itself, Aditi Mishra, who's the principal of a premier school, the Delhi Public School, based out of Gurugram in Haryana, is with us. And Dr. Sameer Dalwai, he is a well-known doctor who has devoted his life to children, but also a member of the Maharashtra Task Force, is with us as well. And Sameer, in fact, I will start with you. I think you've been talking a lot about the impact on the mental health of children, but what really concerns me is how much longer this can actually carry on, because this is endless. Even if we're talking about a possible vaccine for children, that could take months, if not years, given the fact that only 10% of India is fully vaccinated. Where do you weigh in on the reopening of schools, Sameer?
So good evening, Barkha ji, and thanks for having me on your show. And I will quote what you said, that this is endless. And this is going to continue. The state of uncertainty that we are in, nobody knows what to expect next. And what's happening is there has been a tremendous psychosocial impact on children in the last 1.5 years, more so not just because of the lockdown, but because of the uncertainty. And we know all the problems and the pressures that come on with staying at home. And the picture that you are showing on your screen right now, for example, these are children who are not only missing out on the academic or the cognitive or the intellectual part of academics, but also maybe a midday meal, or maybe even an opportunity to get out of the house and the situation that they may be in, as compared to somebody in a Tony school in South Mumbai or in Delhi who has a completely different view on the matter. What is important, however, is to understand what can we do right now. Schools have to open, will reopen, and the authorities will take their own time depending on the evidence and the percentage of infection in that particular area, so on and so forth. Having said that, there are two parts to the problem. One is the physicality of opening schools. There will have to be certain parameters like social distancing, masking, how many children can be allowed inside a classroom, alternate day schools, so on and so forth. On the other hand, what is important is, are we getting ready for school? The problem here is we have been focusing on the first part, not on the second. And the second part is more crucially important. When the lockdown stuck, children thought they are getting a vacation. So the transition was not so difficult. But now that they have been at home for a year and a half, with the good and the bad effects of staying at home, away from social interaction, away from meeting community, away from living up to a schedule, away from meeting deadlines at academics, away from performances, and away from the spotlight of marks, Suddenly to get back into a schedule, suddenly to get back into clockwork kind of a day, to get back to performance and to catch up to speed with academics is going to be a uphill task faced with the emotional baggage they are coming in. So I'll close by saying my appeal with folded hands to all educationists is schools जब शुरू होने होंगे होंगे मगर start preparing for two things. First couple of weeks, let's only look at the psychosocial rehabilitation of children. They're coming back from a COVID house, from a COVID India, from a COVID world. Let us have a couple of weeks where they can just emotionally express themselves. Let us not start with the academics. Let us just give them that opportunity to catch up with their friends, to meet and greet, even
Yeah.
if not work.
And I'll get into what schools should do when the children come back in a moment. But what if parents simply do not send their children to school? Aditi, your school, the Delhi Public School, is in a state where the state has now permitted schools to open.
Yes.
I must also say for our audience that when you look at the dashboard of cases, for example, I know some of you will point me to the headline of over 40,000 cases, fresh cases in India in the last 24 hours. It is important to underline that 50% of these are from one state of Kerala. So COVID is not an equally spread phenomenon in the country right now, and therefore different states have, taken their own decisions. Aditi, what has happened since you have opened school? What is your experience on the ground?
Okay, thank you. So, when this decision was made by the government to open schools in Haryana, we sent out a Google form to parents, and I was quite happy that almost 25% parents agreed to send their children from classes 9, 10, 11, and 12. And I'm feeling shocked while saying I was happy because I expect 100% attendance on other days. The children love coming to school, but their parents cited reasons of safety and vaccination and vulnerable adults at home, etc. Now, with these 25% children, we were very happy to start school from Monday, that is the 1st of August. And for the past 36 hours, I have been receiving every hour a mail or two saying that we've just changed our mind, it's not so safe anymore, the cases are rising. And I'm going hoarse saying that this might go on indefinitely, as the good doctor has just said. And we have sent out a task force. We've talked about distancing, we've talked about masking, we've talked about sanitization. We have even, changed infrastructure of the school in such a way that the children don't have to touch things. Everything is now foot operated. The flushes, the water tankers, we've done all of that. And still, if the parents are uncertain, unfortunately, in today's day and age, the principal and teachers are not very forceful. We cannot be. But we are goading, we are sort of coaxing them to come to school. And coming to what Dr. Parikh said just now, we have allotted almost 15 minutes before every class for socialization. I have forbidden studies to start in the first 15 minutes of every class, whether it's
Yeah.
geography or physics or maths. Just talk about the day, talk about what you ate, talk about what you made, talk about how you're feeling right now. And I think that is very important because children are in a very contrived situation. We had never imagined that this thing would happen, and they would be
Yeah.
inside without their social interactions, in place. They've not met their friends for 16 months now.
Yeah.
I think it's
Yeah.
high time we opened our schools with the proper precautions and had the children back in school.
Now, I want to look at the science of this with you, Swapnil, and then I'll get the perspective as a parent from Seema. The fact is, one, there was initially a lot of panic because people said third wave, children are going to be more vulnerable. Our experience of the second wave was that younger people's lives were being claimed, possibly because the elderly were vaccinated. Then again, and you and I have had this argument, I feel that the dashboard, when the reportage is X thousand of cases, it creates a complete sense of alarm because nobody will then go to the second level of detail and say, okay, where are these cases coming from? And actually, many of the waves are localized. So the whole country doesn't have to shut down for them or restrict behavior for them. But if parents just refuse to send their kids to school, how will schools open even if the state allows it? Sapni?
Hi, Barkha. Thank you for having me on. Um, First, just to touch upon, to explain a few things, for the viewers. There is a difference between susceptible to infection and vulnerable to severe disease outcomes. So, what we do know is that children can get infected by the virus, but we know, right? Even adults, many people who get infected have very mild infections or even asymptomatic infections. And a small subset, not that we can ignore that subset, it's very important. We look after people who have severe disease. But fortunately, most children are not vulnerable to severe disease. They are susceptible to infection, though. If we look at the pediatric sero surveys that have been done, for example, the BMC did a Mumbai
Yeah.
citywide sero survey. Kasturba Hospital led this sero survey. There was a seroprevalence of about 51% between 1 to 18. And despite that, again, I'm being very categorical that we should always aim to reduce infections. But despite the fact that so many children, so many people below 18 have been exposed, we haven't seen a huge uptick in severe disease manifestations. So I think
Yeah.
that's very important to reassure people with that information. Now we have to come to why were schools closed to begin with. Sometimes people feel that we close schools to protect children. That's actually not the case. When we talk about intervention, we have to talk about the benefits of the intervention and the cost. This is
Yeah.
one of those areas where children bore the cost of the intervention, but the primary benefit was to
Or
reduce
the
transmission
adults.
in the country.
Yeah.
So we have to
Yeah.
look at the various factors that drive down transmission, that bring the RT below 1. And if we were in a situation where we had to shut everything down, where we were seeing massive exponential growth, the hospitals were overwhelmed, that's a separate conversation. We're not in that situation right now. But more importantly, like you pointed out, we've opened up bars, we've opened up lounges, we've opened up restaurants, we've opened up offices. And this just speaks to the attitude in our society that we don't view schooling as something that's essential. It's possibly one of the most essential things. I'm sure Dr. Samir can speak about this more than I can, but there are certain key developmental points in a child's life. It's so much more difficult to learn a language today than it is when
Yeah.
you are a child. There are some things that you just learn best at a certain age, and the midday meal program.
And I
There's
want to discuss the impact on both the economics and the psychology of children. But Swapnil, if you can speak to the science, I'd like, for example, I'm seeing a comment from a parent on the live streams that says, I will not send my children to school until the majority of adults are vaccinated and there is a guarantee that there will be no third wave. Now, if we keep waiting for this guarantee, we're never going to open schools. And given our vaccination rate, it's going to take us a few more months before 70% of our adult population can be fully vaccinated.
So let's be very clear on this. While parents do have the last word on what happens to their children, at some point we have to leave this decision also to experts, right? Because otherwise every parent will decide tomorrow. Someone could say that I don't want to send my child to school for X reason. And so
Yeah.
they have to, at some point, we have to collectively as a society take a decision that this is the science, these activities are safe, but very importantly, we also have to ensure that the necessary precautions are taken. I heard a lot of discussion here about sanitization and touching objects. That's not how this virus spreads at all. All of that has marginal utility, but unless you're talking about cleaning the air, unless we're talking about ventilation, air filtration, indoor air quality, and high quality masks, we're not doing enough. And testing. We have to
Yeah.
look at testing as well. So the science of this is that we are seeing in the UK, for example, for right now, with seroprevalence of about 90% a few weeks back, they
Yeah.
still had exponential growth. So even if we talk about vaccinating all adults in our country, that's everyone above 18, that's about 65% of the population. That is going to be inadequate to contain spread. And of course, we're not going to get to 100% vaccine coverage in everyone above 18. 35% of the population is below 18. And even if we have a vaccine approved in a few months, which I have questions about whether that will happen, but even if that happens, there is no way that we are going to manage to vaccinate. Even ethically, how can we vaccinate people below 18 who have a much lower risk of severe outcomes when there are adults who haven't been vaccinated in India and other countries? So I think the science is very clear on this. We are going to have
Yeah.
transmission in our country for a while. but we have to recognize there are huge downsides to keeping schools closed.
What schools are battling is the absence of cooperation or participation from parents. So I want to get Seema to come in here, who heads a major parents nodal organization out of Hyderabad. Seema ji, क्यों parents नहीं मान रहे? आप लोगों को क्या fear है, क्या doubts है? The fact is कि शहर खुल चुके हैं. हम लोग बाहर जाते हैं, आप भी बाहर जाती होंगी, ये तो नहीं मैं मान सकती कि आप पूरा दिन घर में ही बैठते हैं. तो आप जा सकते हैं, तो अगर आपके बच्चे हैं तो वो क्यों नहीं जा सकते?
Ma'am, because I think parents have a bigger fear in their minds, and I think it is they have to have that assurance from the schools about the infra in the hospitals, and there should be some assurance from the government side also. If at all it spreads, like there is some infection occurs, how they are going to really help. If there will be facilities available there in the in the hospitals, and there will be definitely there will be requirement of different
But ma'am, you just heard the doctors say that it's very a very small percentage of children will ever need hospitalization even if they test positive. So for example, you don't stop your children from going to school because dengue hai ya swine flu hai ya flu hai, right? You don't do that. Even so why do you feel? I know this is so far not a regular flu, certainly not for adults, it is not, but for children there is no science that shows that children in significant numbers develop serious disease. Seema ji,
ma'am, we have seen deaths in our neighborhood. We have seen so much of bad happening around. I think children also are very much aware of the situation, and even I think they are also looking up to their parents for the permission, you can say. And parents are just trying to be very, very sure before they send. And as soon as I think as Haryana, Rajasthan and Gujarat, some Haryana mein schools open hue hain, but I think parents are still not sending. Even after confirming, they are not sending, because when it comes to do it practically, again they are held back with all the fears. And I think there is a gap, communication gap, that has to be filled between
I think that is a good point, that I think the science has not been messaged effectively. Just before I come to the two doctors, Aditi, what is the biggest challenge that you're facing? You said kids aren't showing up, but are you planning to keep the school open? One. Two, how many of your teachers, because we don't talk about this often enough, have been able to be double vaccinated?
Most of the teachers have been double vaccinated, except those who have just had one jab because they were of a certain age. So we've been very careful in making the timetable, because the government was very clear that when you start offline classes, you can't stop the online class. So there's a parallel timetable happening. There are some children who are in school, even if there are 5. I don't want to stop school just because there are only 5, because I hope these 5 will urge another 5 to join in the next week.
Yeah.
So at this moment, as I'm talking to you, just half an hour ago, I was sitting and making the timetable sheet. There are some sections with only 7 children coming, some with only 3 children coming. I said, let them come. Let them at least learn to be in school, to look around, walk, talk to each other, maybe sing, dance, whatever they want to do. And then hopefully parents will get that confidence. We have also sent them a huge PowerPoint presentation. The doctor says we need not show, there's no transmission by touch, but then everybody's going absolutely bananas with the sanitizer.
Yeah, but this is just galat. This is my problem, that the science has not moved, and I really want to go to the doctors about this. Yeah, this sanitizing, ये शुरू में हुआ था, gloves, sanitizers, contactless deliveries, जैसे कि पैकेट छूने से कुछ हो जाएगा, टेबल छूने से कुछ. This is complete anti-science bunkum, Sameer, and we are still seeing it everywhere.
It's everywhere.
This is not a fomite transmitted virus, right? And it's just so frustrating to see people doing these kind of things instead of focusing on, let's say, chalo, if you have a ground, let's do open air classes, let's do classes under a tree. Those are the things we should be talking about where it's possible, or keep the windows open in the classroom where it's possible. Sameer, can we unmute him? Yeah. Sameer, you're on mute.
Sorry. So you're right. There are two aspects. The Maharashtra state government COVID task force has already made its own recommendations about what should be the reasonable precautions that should be taken in the school in terms of the physical precautions. to prevent the transmission. Because let's understand that on the playground, it's a different situation. In India, classrooms are packed, you like a tin of sardines, if I may say so. So the conditions are different. The ventilation, we don't know. The high-end schools have air conditioning, and you're not allowed to or supposed to switch air conditioning. Are there fans and cross ventilation? Whereas there could be schools in the countryside where there is no fan and there is no air conditioning, obviously. So it can't be the same size fits all. We've made recommendations from a medical point of view, and we'll leave it to the education boards and the schools to do what fits best for them. Having said that, what we must also understand is no parent in India, I can say that no parent in India wants to keep his or her child at home. The number of people from the low socioeconomic classes who take loans for the children in school is not funny. So everybody wants their child to go to school. The trouble is most of them want their child to go to school for academics, and that is what I was cautioning against earlier. But I think Ms. Aditi ma'am has made a great point about that already. Don't start with academics. What I think is, like some gentleman mentioned, that is what is a guarantee. The only guarantee available today in life, my friend, is there is no guarantee about anything. And we will have to take that step forward. There is enough evidence to say that children do not get serious disease, but there cannot be demands from parents that every teacher in the school must be double vaccinated. What if a teacher chooses not to get vaccinated? I am not supporting that. I have taken my 2 jabs, and I request all of you.
No, I'm sorry here. I back vaccine mandates, but of course there has to be enough of a supply of vaccine. But I am, Swapnil and I have had this argument before, I'm an early votary of vaccine mandates, and the world is now doing it.
Yes,
The
absolutely.
The Washington Post today said all of its employees are obliged to be double vaccinated. And I think in our cities, at least, we do have enough of a supply of vaccines in our socio-economic strata. I think rural India is where the vaccine crisis is, actually.
My point I was trying to make is we will have to start sending children to schools. And as ma'am mentioned earlier, let us start with the children who are happy to come to school, or parents who are willing to send their children. And that is how the trickle will keep on building as more and more people get the confidence. Because we will have to make a start, the sooner the better, but we can't force any parent to send a child to school, because as the lady who runs the parents group mentioned, correctly, Simaji mentioned, there is so much of fear and so much of a paranoia in the people's mind that forcing them will be counterproductive, in fact. So let's keep an open policy where those who are confident and comfortable, let them start sending their children. Let us have less of academics to begin with and more of a psychosocial.
But how do you get them to send their kids? And Swapnil, here I have a bone to pick with you, because I believe that if we are going to keep obsessing, like I've been arguing for a while that the national dashboard should now no longer release the numbers of infections, and I know everybody violently disagrees with me on this. And it's not that I'm trying to sort of be Orwellian and say cover up data or whatever, but I just think there's so much misinformation that the moment you hear, for example, 43,000 fresh cases in India, the next step, if I were to ask Seema ji, do you know 50% of these cases are from Kerala? I'm sure she will not know. Then there'll be some headline, breakthrough infections despite vaccines. Nobody will bother to tell you that it's an outlier, that you will not end up in hospital. You know, it's like saying you can get dengue 4 times. Nobody panics about that, right? I'm not minimizing COVID. You know, I've had COVID. My father died from COVID. I'm not minimizing COVID. But the point is, this can't carry on. The world cannot carry on like this. Our country cannot carry on like this.
So about reporting numbers, I think there is going to come a point in time where the science backs switching from reporting numbers, where we start, at some point we'll either start treating COVID-19 like we treat other diseases, or then we have to start treating all other diseases like we treat COVID-19. At some point we will make that transition to endemicity. I don't think that we're there yet. Right now, we do need these numbers out because there are independent researchers, right, who need access to this information. I don't think the solution to misinformation is that we put out less official information. We need to combat misinformation and disinformation by education and information campaigns. That aside, I mean, we can go back and forth. I do think what you're saying is valid at some point. At some point, we are going to make that transition. That aside, I think right now, the message that we have to send to parents is that you are thinking of the worst case scenario happening. And I'm not minimizing it, because there are so many children who will get infected by COVID-19, by SARS-CoV-2. The small percentage of children who do have severe outcomes can still be a large absolute number. So I'm not minimizing it. I very much want to prevent infections in children. But what parents need to understand is they are focusing on that low risk of what's happening right now and neglecting the high risk of what's going to happen in the future.
So does that need to? So can I ask you a question there? Somebody's objecting that I do analogies with dengue and malaria, saying that it's a stupid point to make because if I take up the question, it's a stupid argument by Barkha. Just because we have dengue, malaria, we can never stop sending children to school because they didn't kill 4.5 lakh people within a matter of 15 months. Yes, but I do not believe that the country can remain closed forever, irrespective, and that has been my consistent position through this pandemic. And my submission to you, Swapnil, is that a school cannot panic if there are 2 kids who test positive. We have to make testing positive, not trigger the kind of alarm that it triggers in organizations. Can you and Sameer speak a bit about that, and then I'll start taking last comments.
So first about malaria and dengue, I think most of us who actually work in infectious diseases in the pediatric age group, we'd probably be more worried about respiratory syncytial virus, dengue, malaria, a whole bunch of other pathogens. The scary thing about SARS-CoV-2 was just that the population was naive to it. There are far nastier infections in children than COVID-19.
Yeah.
Coming to about what the mechanism should be to respond to COVID-19 in a school, I think we need to first understand what are the measures to put into place. So I am an advocate of testing, of aggressive testing. There are ways to make this process convenient and painless for children. There are saliva-based tests. There are tests coming out beyond just antigen tests. There are going to be a whole gamut of different kinds of tests, spectroscopy-based tests, for example. So a lot of different kind of testing methodologies on the horizon. In terms of how do we make classrooms safe, the key things are high quality medical grade masks. So that's something that's going to be part of our life for some time. And then it's all about air quality. It's all about indoor air quality. So ventilation is one part of it. But if you just open up the windows, like in a city like Delhi, you will have pollution coming. In some other parts, you might have mosquitoes come in and cause dengue and malaria. So you also need.
But there's no perfect answer. These schools had air pollution.
Air
pollution existed prior to COVID, right?
But we weren't opening up all the windows before COVID, right? So what you need is air filtration. So you need HEPA filters. The cost of these systems ranges somewhere between 200 to 500 rupees per student. So you can have one of these air filters for a space that's about 500 square feet in size, and it's going to do about 3 to 6 effective air changes per hour, and you put a CO2 sensor in the classroom. So that kind of gives you, for example, your breaks will happen outdoors or your breaks will happen in a different space. So there are protocols in place around the world. And guess what? There have been studies conducted on this. And when these protocols are followed, there isn't transmission in school. So instead of saying that, okay, if our mechanisms fail, then we'll just ignore it and say that, we don't need to respond to a couple of cases. I want to tell you, there have been schools that have had 0 cases. While there has been transmission in the community, there has been 0 transmission in schools if you do it correctly. So that's what we have to focus on. How do we do it correctly?
Yeah, and I think that's a great point. But I also do want to say to you, Seema ji, that actually India is one of, I think, 5 countries. UNESCO made that point this week. There is one of only 5 countries that has had such a long school shutdown. Point 1. So the rest of the world, by the way, has kept schools open. Has found ways to keep schools open even through lockdowns. That's the first point. The second point, Seema, is the following. When children stay at home, unless you're planning to never let them out of the house, if they're going to remain in indoor spaces, that is actually making them more vulnerable to a whole host of mental health problems, to a whole host of physical problems, actually even to COVID-19, because the virus is most transmittable indoors. At least if they go to school and let's say they spend X number of hours out in the open fields, that's actually safer for them. The outdoors is safer than the indoors. Siba, what guarantee are you looking for?
It's about the fear of the parents. That's what I'm saying, that there should be some communication from the school management to the parents, and I think that should be all the teaching and non-teaching staff should be vaccinated, and every parents' fear has to go first thing. And I think eventually, as Aditi ma'am told, that they have opened and still like waiting for the children to really like come to the school. But I think if they keep it open, and I think they will start sending when they see when the facilities that are required to maintain that sanitation, and as she mentioned earlier regarding the flushes and all, that is like without touching with the foot.
Yes, but we just told you that it doesn't spread by that. That's the point that no one's ready to listen to. In the beginning, when we didn't know enough about this virus, certainly there was a sense that it could spread by touch or surface, but we know now that it's airborne. We know that the basic thing, Seema ji, is that you need to wear masks, and masks are even more effective than vaccines, or as effective. Sameer, my question to you is this, that the science is not communicating effectively. We are still in the old template of the 2020 management of COVID.
The old 2020 is only about a few months back.
Well, yes, it feels like another life. Yeah.
Unfortunately, that's not true. And honestly, there's who can, without doubt, tell us how many children in a classroom of how many square feet would not have a single case of COVID. It's not going to happen. It's not going to happen. The cheese has moved, and eventually, if you ask me, it's going to be the parent, that school, and that group of teachers and that group of parents who will decide their local situation on a week by week basis, if not a day by day basis. It's going to come to that. And parents' involvement in school is going to be much more on the ground than it was ever before. Having said this, let's understand that there are some ground rules. All of us have to follow some ground rules like masking, like you said, Barkha. Beyond that, we have to take it as it comes. There is tremendous impact of keeping the children locked up at home. At the same time, we have to get our courage up. As somebody said about malaria and dengue and passed a comment, add one more to that list of malaria and dengue. It's called COVID. It's here to stay. You will keep getting Delta, Lambda, this variant, that variant, and it's going to happen till the human race develops its own resistance to it and to all its variants. Let me ask you a question. Did you ever observe which is the current variant of measles virus going on? It must be the 10,000 variants since we came to know about measles, since we started following the measles virus or recognize it as a virus. Viruses will mutate. This also will mutate, but we are not so scared of measles now. One, because we have effective vaccination against it, and second, in the cases that do get measles, we know effectively how to treat it. So over a period of time, this fear will go. My plea is not to force anybody, not to force the schools, not to force the teachers or the parents. The government and bodies like the task force will give you local guidelines. Try and follow them. Take a leap and start sending at least those children who parents are happy to send, do send. So there'll be less number, there'll be less crowding, and gradually these kids will build up immunity and the message will spread across. I think that's the way to go.
Yeah. I just want to get Aditi here, but also to underline the digital divide of this country. The preoccupation with the reopening of schools is a very urban, elite phenomenon. Pratham has a report out which actually underlines how millions of Indian children have fallen out of the school system. This is impacting girls much worse than boys. If there is one mobile phone device in a home, the boy gets the opportunity to study. We have personally reported on underage girls who are being pushed into marriages because their families think कि अब क्या पढ़ाई तो कर नहीं सकते, इनकी शादी करवा दो. The repercussions are deep, and it is only the rich who can afford to have this debate over whether to send their kids to school or not. For the poor, it's a completely different set of compulsions. Aditi?
I agree completely. We also run school for the underprivileged within the same premises, where we educate about 1,500 children. They do the open school curriculum, and it was very sad last year in the month of June when the entire, the mobile population was moving out. Almost 500 of them were forced to leave our school and go to their villages. So in my wisdom, we gave them a lot of worksheets, a lot of books which were with us, and said, you keep in touch, we'll keep talking to you. But I must admit, it's not been very successful. Only 20% of those children were able to reach their phones, even at night. The teachers were so committed, they said, we'll talk to them at 8 o'clock in the evening. That's not a problem. We have begged and pleaded for devices to be given to such children who are from very marginalized homes. Well, again, I'm honestly saying, this is a very urban thing that we have a school and we are able to run it. But I know the situation in rural areas, in small kasbas, in small schools, where the children are not able to reach out to books, where the teachers have been put on other duties and have not even gone into classes.
Yeah,
So,
it's a complete humanitarian crisis that's actually unfolding, and a mental health crisis, and a sort of psychological development. I mean, there's so many crises that are going to emerge from this that we are completely underestimating. So, Dr. Swapnil Parekh, let me put you on the mat, give you the last word. Would you recommend the opening of schools, yes or no? And the second question would be, what would you advise schools to do? Let's say Aditi's school, the kids who are coming, 2 kids test positive. Our earlier response used to be shut down the school. I think we should have learned better by now that the kid, symptomatic or asymptomatic, needs to be isolated, or we move to a system of rapid, quick, either daily testing, which the United Kingdom is experimenting with, or at least weekly testing. But the school doesn't have to be closed.
Yeah,
Let me give you a simple example.
Sorry, Sameer, you want to jump in? You want to jump in and then Swapnil can take the last one. No, go ahead. Just jump in. I'll give Swapnil the last one. Yeah,
Sorry, just let me give you an example over the last 15 months. Initially, there used to be such a hullabaloo around the areas where there was a COVID case. I remember the entire locality is being cordoned off. अब किसी फ्लोर पे वो एक फ्लोर पे थोड़ा सा cordon off होता है, the rest of the society and building is going on. It will be the same thing in schools. So it has to be individualized. My second plea is to those who come from very fortunate and blessed backgrounds where they are completely happy to have an online laptop for their own child and education is going on. One, don't make the mistake of thinking that education can ever come off a laptop, even if it is a high-end one. Second, don't generalize, because the voices of people like us who are blessed are sometimes much stronger than the millions of those who don't have a voice. So that's why I said, those who are comfortable to get a home education, let them continue, but let them not make blank calls that there should be no opening of schools. So I am for opening schools as soon as possible.
Well said, Doc. Swapnil, last word.
I agree. Let's open schools as quickly as possible, ASAP. And let's also put in the necessary interventions. So just to quickly summarize what those are: high quality medical grade masks, testing, frequent rapid testing, ventilation, air filtration and indoor air quality is critical. Cheap, low cost, portable HEPA filter based air cleaners. We need these in schools. And if we do get to the eventuality that there is a student who tests positive, the whole point of all these measures is to reduce transmission, reduce the risk of transmission in the school. Just because one person tests positive in the classroom doesn't mean that everyone else was exposed. So we follow the contact tracing protocols. We isolate the student and support him with medical care while he's infected. And the rest of the students, we use our contact tracing protocols, identify the ones who need to be quarantined. There's also an emerging thought process now that instead of quarantining students, what we can do is we can do daily rapid testing for 14 days. And if they do not test positive between those two rapid tests, as long as you're doing it daily, they're free to go about their activities. So we experiment with these different methodologies, but the important message is we need to open schools safely ASAP.
And for this, we need the participation of parents. I would even argue that teachers should be treated as frontline workers who should be provided vaccines if vaccines are not available. I would also argue that teachers who are declining to get the vaccine, it should be made mandatory, but that's a conversation for a separate time. Vaccine mandates is something I need to bring the doctors back for. But in the meantime, Aditi, good luck. I hope things start looking up. Seema, we urge you and other parents to consider and reconsider and also relook at the science. It has really moved a lot from the beginning of 2020 in terms of the understanding of what is needed and what is not needed. Like today, when somebody offers me gloves to wear, for example, even to go inside a COVID ward, I do not wear them. There are things that we know that we did not know in 2020, and we have to count on those. We just cannot afford to treat our children like this. Leaving it there, thank you very much to our panel and to our audience. Thank you. It's been a lively live stream. We'll see you tomorrow, same time, same place. Thanks for watching. Goodbye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to MOHFW Story and support independent, robust journalism.